Good afternoon, everybody, and I'm so glad you're here. We're going to learn about affordable health care insurance. I am Debbie Walter. I work at the library, and I'm very happy to introduce Shalini Rajput. Shalini, would you like to introduce you? Shalini is an assistant counselor working for New Jersey Citizen Action Education Fund, which is a nonprofit organization providing free help, emphasize free, for the state's ACA healthcare program. Shalini, take it away.
Thank you so much, Debbie. Good afternoon, everyone. My name is Shalini Rajput. Like Debbie said, I'm a certified assistant with working with New Jersey Citizen Action Education Fund. It's a nonprofit organization. And I thank you in advance for all of you coming in. And I thank you, Union Public Library and Debbie, for having me on today. Having said that, let me start sharing my screen and we will start with our presentation. Feel free to ask any questions in chat and I will go to it once I am done with my speech. So here we go. Today's topic is ACA COVID-19 special enrollment. Although the topic sounds heavy, it's special enrollment for healthcare. COVID is because we are in COVID era, unfortunately, and ACA is Affordable Care Act. So we'll talk about how can we get Affordable Care Act. Even we are in September and I'm talking about enrollment, sounds bit off, but yes, it is possible this year. That is why I said special enrollment for COVID-19. Before I start, I just want to let you know that all the information I'm sharing here is mostly compiled by me and my colleagues, and to the most of our information, it is correct, but it does not necessarily reflect the views of federal, state, or local government. A little bit of our organization, who is Citizen Action. New Jersey Citizen Action is a grassroots organization that fights for economic and social justice. We have many programs running. We have many free services that you can definitely take help of from the comfort of your own house. You just have to call. We provide help with healthcare enrollment, which I'm talking today. We provide with tax preparation, free help for those who have 65K or less earning, financial coaching. We also provide first-time home buyer counseling. We provide help with fair housing, and we also have NJCA Oil Group. If you need more information, feel free to go to, or I would suggest, please go to njcaef.org. Please explore. It's a very helpful organization and all services are free. So what is Affordable Care Act? It makes the health insurance available to more people, and we get benefit for premium tax credit, and the cost for household of income between 100 to 400 FPL is lower for healthcare. It expands the Medicaid program to cover all adults below 138% of federal poverty level. I will explain what it is in very short time. And it does provide medical care delivery methods easy to access to everybody. So it's more and more friendly for us to use and easily accessible all the benefits. The enrollment, special enrollment runs from February 1st to October 31st, 2021. I'm saying special enrollment because usually the open enrollments runs from November to January 31st, and anybody who is eligible under special circumstances to enroll can enroll for healthcare after February 1st. This year, there is a very special enrollment called COVID special enrollment. So anybody who was not able to enroll themselves for healthcare because of any reason, they are still able to get the enrollment under COVID-19 special enrollments. I was talking about FPL. So this is just a small chart that explains what FPL or federal poverty level is. This is just an overview, not exact accurate, but just an overview. So if I say 100% FPL for one person, that is if somebody is earning 12,880, there is one person in the family and they're earning 12,880 for the year. Same thing goes for 400%, that is 51,520. If there is one person in the family and they're earning this much. So this limit is covered by under ACA. Same thing goes for 2 people, 3 people, and 4%. The limit for this year has been increased. Like I said, this is a special year, so the limit has been increased. And even if you do not fall under this limit, do not hesitate to go online and check your eligibility, because this year, and I'll keep on saying this year again and again, so don't think I'm a broken record, but this year is special. And the limits have been eased out very, very much. So Affordable Care Act provides many facilities. It covers people even if anybody has pre-existing health condition, they are not denied for coverage. Preventative care is absolutely free once somebody enrolls. So well woman checkup, our cancer screening, yearly checkup is absolutely free of cost. You do not even pay the copay when you're enrolled under ACA. Young adults get more coverage options. There is no yearly lifetime dollar limit. Insurance cannot come back to you and say, we have spent so much on your coverage and you are not allowed to get any more coverage. No, it does not happen like that for ACA. You get full coverage. There are no rate increases by the healthcare insurance. You will get the rate what you have signed up for initially. Insurance companies cannot cancel your health insurance just because you get sick. So they have to give you the full coverage. I have been enrolling many people, and 99% times people are able to choose the doctors that they like to go to, and they would be in network. So if you are already seeing a doctor, and if you know that this doctor is good and I want to go to this doctor for my healthcare, 99% of times you will be able to choose that doctor under ACA programs. And it does protect you from employee retaliation. Okay, so before we take the healthcare, we need to understand 3 W's: why, what, and how. First of all, you need to ask yourself, why do I need health insurance? What is my need? There would be a healthy family or healthy individual who just need health insurance to stay healthy the way they are. And in order to stay healthy, you must get that preventive checkup done. You will not know what's going on with your body unless you get that checkup done. I hope everything goes on well, but the checkup is always advisable. I get it done every year, and I would recommend anybody that comes in contact with me, I advise them. Why is it important? Why the healthcare is important for you? Like I said, you just want for well visits, or there is something going on and there is a condition, there is a special thing that a special I won't say thing, a special condition that we want to be taken care of. It can be just blood pressure, it can be just any simple thing, a diabetes control. So that can also be taken care of. And once we know that we have that power of healthcare, we can go to our healthcare provider. Everything is under control. We are able to get the medicine. We are able to go for checkups as and when we want. It's a mental peace. And what do I need and want? What is my exact need? What kind of coverage do I want? What kind of insurance would be suitable for me? If you already see a doctor, what kind of insurance that doctor takes? What are my choices? So there are 3 major providers under ACA, AmeriHealth, Horizon, and Oscar. Each of them provide different choices. They have silver, bronze, and gold plans, many plans. I have seen, like I said, I help so many people with their application, and everyone at least gets 20 choices to choose from. So there's plenty. So you just need to know that what I'm going for before exactly enrolling yourself. And then how much will it cost to me? So you just need to understand that how much can I afford. So this is how what I say, you can make a budget, sit down, make a monthly budget of yourself, that these are my required expenses of the month, and then this much I can set aside for my ACA. You may not need that much, but it's just good advice, so that when you're making that choice, you know, okay, this much I can spend, so I can go ahead and take this plan. So this is what I would advise. And what are the options we have? So there are two major options, especially with ACA or with the Get Covered Plan application. There is NJ Medicaid option, which is from state of New Jersey, NJ Family Care, we can say. Medicaid has three different options: CHIP, which is for children under 19, age 19, adults, which is called Medicaid, and for disabled. You can apply for NJ Family Care all year long. When you can process the application on Get Covered itself, and the application goes two ways. It goes to NJ Family Care, or if you're not qualified for NJ Family Care, it goes for Get Covered New Jersey. I know I'm talking too much, so it's a little bit hard to understand. So in a nutshell, if let's say you apply for NJ Family Care and for any reason, maybe your income is high or the immigration status does not qualify for it, and they come back to say, oh, I'm sorry, you do not qualify for NJ Family Care. What options do you have? You can apply for Get Covered NJ.
Provided a lot of information so far. Maybe we could take a moment and see if anyone has any questions.
Sure, of course.
So if anyone has any questions, you can raise your hand. You can just speak out. I will unmute everybody. Should I unmute everybody, or I think you can all unmute yourselves? If anyone has any questions at this point. Okay, keep going.
All right, silence is golden. So Get Covered NJ, like I said, you can apply for health insurance at Get Covered NJ, which is ACA of state of New Jersey. We have been having ACA before with healthcare.gov. Everybody who was living in New Jersey had to transfer to Get Covered NJ last year. So it is the ACA of New Jersey. Anybody who's living in New Jersey and wants to apply for ACA, Affordable Care Act, will apply on Get Covered New Jersey. You do get financial subsidies to pay the premium. I have seen subsidies coming from state of New Jersey as well as from federal government. And state of New Jersey also have one more subsidy called cost sharing. So anybody who qualifies for that, under cost sharing, if you have any copay deductible coming up, they do chip into that as well. What better can that be? And there is no extra cost to have an assister. Assisters like me are absolutely free to provide our help and services for Get Covered New Jersey. You can just call, and there's many like language options also. So if you go on Get Covered NJ and look for the local assister, you can select them. There is no cost. If anybody asks you to pay, please stay away from that. Like I said, application is very simple, but sometimes there are a few things that we forget to check and we do not get the benefits. I get so many calls. Oh, Shalini, I did my application, but I'm not getting any benefit. Oh, did you check this? Let me see it. I just click one thing. They get like too much benefit. And they're like, oh, okay, now I get it. So you can try, definitely go and try to apply on yourself, look at the application, explore yourself. If you need help, we are there. All I'm saying is we are there. Like I said, 3 options are available. Major providers are Horizon, AmeriHealth, and Oscar. Big questions, when can I enroll? Many people would be thinking this is September and I'm still talking about enrollment. I'm not talking about next year's enrollment. As of now, I'm talking about this year. So even if you enroll by September 30th, even now, your coverage will be effective from October 1st till the end of this year, till the end of December. If you enroll by October 31st, your coverage will be effective from November 1st. And if you enroll by November 30th, your coverage will be effective from December 1st. So on. And I'm still talking about this year's enrollment, just to be clear. What is COVID-19 special enrollment? When I say COVID-19, people think that I have to be affected by or impacted by COVID-19. Me or my family should either have COVID-19 or we should not should, but I will only be eligible if I lost my job. It's not the case. Anybody who is uninsured and is a resident of New Jersey is eligible. Anybody who is a dependent of someone and is residing in New Jersey, let's say the primary earner of the family does have a coverage from their employer, but the employer does not cover the dependents of them. The dependents can apply for Get Covered New Jersey, for Get Covered NJ. Or if you simply want to change your plan, you already have the coverage of Get Covered, and you just want to change your plan, that is also an option available just for this year under COVID-19. There is no documentation required, and a person does not have to be affected by COVID-19 per se. Now you will ask me why the special enrollment period, because we are still able to enroll under COVID-19. This is because some life events do qualify as special enrollment, and apart from this year, if anybody is not able to enroll for health plan, these would be the qualifying events. And even this year, if anybody is impacted by these life events, I would say apply under these because they have their own benefits. The events are like if somebody lost their job, change of income, change of immigration status or citizenship, death of a spouse, married or divorced, birth or adoption, moving to New Jersey, or no longer eligible for NG family care. If you were receiving NG family care benefit and suddenly, with God's grace, we have more income coming in, NG family care says you're earning too much for us, you cannot apply, you cannot stay on NG family care, you can move on to Get Covered NG. Very new this year is pregnancy. Anybody who got pregnant within the year can apply for health coverage as soon as they get the information, the good news, I would say, and they would be eligible for under special enrollment period. Just to keep something in mind, for under special enrollment, the enrollment should happen within 60 days from the event, apart from pregnancy, income change, and death. These events can have a retroactive coverage. Advanced premium tax credit. I just want to go over this because once you see the application, once you go to and Get Covered NJ, this is a big thing. Advanced premium tax credit is the benefit that one get from federal government towards your premium. So this is an advance amount that comes towards your premium, and it can lower the monthly premium what one has to pay. I put 3 times be honest, because it is the most important thing to be honest about the income that you're receiving for the year that you're enrolling yourself for the coverage. The amount of tax credit depends on the household income of 2021. Based on the final yearly income, either you will have to pay back or you may get a difference when you're filing the tax return. So again, I would say please be honest while putting your income information. Try to get the nearest possible figure as much as you can what you would be filing for the taxes. Just an example, I would say for someone who has a coverage for Get Covered, this is a real coverage. I have processed this application for a family member of 3. So people in the family are 3. The total income for the year is 46,000. The household earner of the family was receiving unemployment benefit. So their actual premium was 1,068. Don't get shocked by this. They got the APTC, advanced premium tax rate of 1,066 because of unemployment benefit, and that's, I would go for that. Their total premium of 3 people is $2.14 a month, effective May. You can go and say, wow. And how did that happen? That is because of American Rescue Plan Act, which was put in effect in April of 2021 because to save all of us from COVID. That's what I can say. It provides more financial help to reduce premium monthly payments. Consumers who were already on the plan, or if you know somebody who was already on plan before April and they have not checked their Get Covered account, please encourage them to submit their application and they would see the difference. But by now, I'm sure Get Covered has already adjusted everybody's premium to the one that they're supposed to receive. Anybody who was not eligible for Get Covered before, or anybody who was not eligible for any benefits before, can try to submit the application one more time and they may qualify now, because like I said, the range has been expanded a bit. So those who were not covered before are now able to be covered. Consumers who did enroll by June 30th were able to get coverage starting July 1st. So it's same thing, like I said, anybody who enrolls by end of the month gets coverage following month, first of the month. Unemployment compensation, this is a big, and I would like to focus a bit more on that. Anybody who received unemployment benefit in 2021 is getting nearly free coverage. I wouldn't say completely free, but it's nearly free. They are paying near $0 premium. I've seen people paying 65 cents, 75 cents a month premium for the full benefit. So if you know anybody who is receiving unemployment benefit, this is the time for them to get any healthcare coverage. This benefit would end by end of this year. So there's still time. They can definitely get the coverage and take care of their health, if already not done so. Just a bit of language I would like to go through, and these are mostly the terms that you would see while filling up the application. A premium is the amount you will pay monthly for health insurance, just like we pay our car insurance premium. Deductible is the amount one must pay before the health plan begins to pay for services. So if you see your deductible says 400, that means that 400 need to be met for the services that says deductible applies before the insurance starts shipping in for that service. Not necessary for everything. It's only for the services that says deductible applied. Copayment is a set fee you pay every time you will see a doctor. Usually it's $5, $10, $15, $25, depending on the coverage that you take. And this would be most likely on your insurance card once you receive the card. Co-insurance is a percentage or a portion that you pay for a certain benefit or certain care that has been taken care of. It's nothing but when you hear 80-20 or 90-10, that 10% or 20% is your co-insurance. So basically a portion of the bill that you receive after insurance have paid their portion. It's very important for us to know what the plan will pay for. And I highly recommend to go in network. Everywhere you will see, it will say, when you will see a benefit, it says in network and out of network. In-network is nothing but the providers or doctor's office that have negotiated rate or contract with the health plan to provide the service. I will say this again, please try to stay in network as much as possible. And I have seen the coverage for each of the insurance so big, I have not seen anybody going out of the network so far. Out of network is the doctor's office health plan does not have a contract to provide health services. Again, this is not really a recommended option. Not, I wouldn't say option, but recommended by me. Because of course the cost from your pocket would be higher in that case. Most plan does require a referral, and the referral will be given by your PCP in that case. Okay, so now you have a health insurance, you did apply, you got your application done, you took the coverage, you have your card, you want to go to the doctor. How would you see if a doctor is in network or not? I have a very lovely neighbor. She gives me recommendation for her doctor. I want to go and see a doctor because the doctor has been very nice to her. But I'm not sure if going to that doctor makes my pocket heavy or not, or not heavy, like lighter or not. If that doctor is not in my network, then it's not a good idea. So you can call the insurance company. The number is always on the back of the insurance card. You can call them and give them doctor's name and tell them that I want to go and see this doctor. Is this doctor in network or not? Or you can check the insurance website and the doctor's name. If it is listed in network, then please feel free to go. Or you can just call the doctor's office and tell them that this is my coverage, this is my insurance. Do you fall in network? Easy. But please check before you go. Again, I cannot stress enough on this. This is how the insurance card looks like. We try to make a replica of it. So this would be the member's name, what is your authorization, what kind of coverage it is, PPO, HMO, EPO. This would be your physicians, how much copay every facility takes. Some would have all of this, some would have few of that, but PCP or special visit most likely be there. So like it says PCP or primary care physicians copay, special visit, how much copay you have to pay, urgent care, how much copay, and emergency room, how much copay. Simple. And on the back of the card, you will have the contact information for insurance company. Just remember, before you start your application, why do I want it? What do I want? And how much can I spend on it? Please be honest when reporting yearly income. It's very, very, very important. And last but not least, please maintain your health by obtaining health insurance. Please go online on Get Covered NJ, check yourself, look at the application. If you need help, we are there. Just give us a call and it's very easy. Like I said, Citizen Action provides many help. All of them are free. You can just call the number, get the information and go from there. I will leave this slide on for a few minutes. So if you need any information, you can definitely take from here. I will also email this slide to Debbie. So anybody needs that information can contact her.
Great. And I'll send that out. I'll send that out as soon as, if you need it sooner, just email me, but I will send it out as soon as I have the tape of today's presentation. So I'm going to stop taping. I'm going to stop taping and